So Truveta grows to more than 15% of US patient care with 3 new members. So Truveta is this partnership that has formed. They've raised $100 million, giving it probably $1 billion valuation if I thought about it. I'm not entirely sure what it is, but essentially they've pulled data together. The initial health systems, Advent Health, Advocate Aurora, Baptist Health South Florida, Baylor Scott and White, Bon Secours Health, Common Spirit, Hawaii Pacific Health, Henry Ford Health System, MedStar, Memorial Hermann, Northwell, Novant, Providence, Centera, Tenet, Texas Health Resources, Trinity Health. And actually, I threw in the ones they added. They added 3 recently, and those are Baylor Scott and White, MedStar, and Texas Health Resources. This is an awful lot of data. They have $100 million that has been invested in the organization, and they're going to be bringing this together for the good of mankind. I mean, that's the whole premise around this is we're going to bring all this clinical data together, make it available for anonymized, of course, for research and those kinds of things. It represents a significant clinical data set. Mostly it's just making people aware that this is growing, and it's a growing trend, that the aggregation of this data. How I view this is all in all, this is a good thing for healthcare and for patients, in that hopefully this will take us closer to identifying cures and getting closer to personalized medicine and those kinds of things. As I look at this, there's a couple of things that are really interesting to me. One is, it appears to me to be more of a capitalist kind of thing than a for the good of mankind. I'm not questioning people's motives here. I think there's an awful lot of good value. I just said that around this, but it's $100 million has been raised. The valuation is $1 billion, and all these health systems are investors. And I think you're seeing more and more health systems say, all right, it's a $4 trillion market. We're not only going to make money as healthcare providers, we're going to make money as providers to other healthcare systems, and we're going to start leveraging the assets that we have to greater value. And one of the greatest assets they have is that medical record that they have amassed over the last decade or two. And so I think they're just tapping into other value streams within the health system and really monetizing that value stream. I'm curious what your thoughts are on Truveta and their direction.
I mean, I think I pretty much agree with you. The concept is kind of cool, right? But it's all going to be retrospective research. When maybe someday, I guess this is probably the holy grail, is can that help drive insights to deliver care to you when you're in the hospital in real time? And what does that mean? And that's, to me, a completely different story and what's got to happen from a mechanism perspective. But that's a lot of data, normalizing that data. You got all that work to do to make it all make sense, but you ought to be able to drive some insights from that kind of data set.